Hello, everybody. Welcome to the webinar. I am Sean Viali. I'm the Learning and Development Manager here at Bitfocus. Our main Bitfocus facilitator for today is Sarah Hoffman. And I don't want to waste anybody's time. So with that, Sarah, go ahead and take over.
Thanks, Sean. Good afternoon, everyone, or for West Coasters, good morning, and welcome to ClarityCast. Today's ClarityCast will be a roundtable discussion bringing communities together to discuss how they built a shared, accurate roster of shelter and housing resources across the COC, ultimately improving system-wide transparency, outcomes, utilization, and most importantly, a person's experience. Our panelists will share real-life use cases and client success stories demonstrating how accurate bed and unit visibility translates into tangible human outcomes, specifically how it expedites the placement into shelter and housing within the homeless response system. For those who are attending ClarityCast for the first time, this is a webinar series that Bitfocus hosts to create a sense of community and discussion around homeless services and how we can use technology to help transform the way we work. The webinars are not just for Bitfocus customers, they're a forum for everyone. We want to provide an opportunity to bring together industry experts like yourself, COC leads, frontline workers, people with lived experience, and more. We want you to hear directly from voices within our industry so they can share the incredible work that they're doing. You can expand your network and position your community to use data, tools, and technology to improve your outcomes. If this is your first experience with Bitfocus, we're a homeless management information system, or an HMIS vendor, offering an end-to-end system to provide coordinated homeless services. Bitfocus is dedicated to transforming human services through data and technology, enabling communities to improve care systems. Most of us, including myself, who work for Bitfocus, come from working in the homeless service sector. So we're not just a software company, we share your vision of ending homelessness. Just talking about logistics here for a second, participants are muted throughout the discussion today, but we encourage you to drop your comments in the Q&A box or any questions that you have. My colleague Scott Jackson will be keeping an eye on the Q&A box and he'll enter any questions that come up. For those who don't know me, my name is Sarah Hoffman and I'm the Deputy Director of the Professional Services Department here at Bitfocus. I've been with Bitfocus for about 7.5 years and have had the privilege of working with communities all over the country to optimize clarity in their homeless response systems. I have also worked in the homeless services sector for more than 10 years before joining the team here. I'm excited to introduce our panelists. Joining me today are Cody Renaud and Joel Bernstein. Cody is a project manager at the City and County of San Francisco's Department of Homelessness and Supportive Housing. He led the launch of the city's shelter bed and inventory system, enabling real-time availability tracking that streamlines placements and reduces wait times. With experience spanning public service and private consulting, his work focuses on modernizing government systems and improving performance across complex public services. Cody holds a bachelor's degree from UC Davis and a master's of public policy from UCLA's Luskin School of Public Affairs. Joel is a data systems coordinator and has worked on the HMIS management team at the King County Regional Homeless Authority since 2022. And for those who don't know, King County is in Seattle, Washington. Joel's focus is on evolving King County's use of HMIS as an active space for collaboration and case management. His projects have included designing workflows for outreach data entry, Medicaid billing, coordinated entry, and why he's here today, the implementation of live inventory. Like many communities, San Francisco and King County have experienced the hurdle many communities face in the homeless response sector, which is the visibility gap and not having real-time data. I had the honor of working with Cody and Joel in their communities over the last couple of years to integrate their bed and unit management into HMIS to help tackle this issue. So let's talk about why we're here today. Every day across the country, dedicated staff are searching for beds and units while simultaneously there are resources that are sitting empty. This is not due to a lack of effort. It can be the absence of real-time information. It can be a communication breakdown, or it can be a very person-centered, time-consuming placement process. Information silos and fragmented systems are also a huge factor in this. When I worked in the homeless services field, I was a housing manager for many years, and I managed the openings for multiple programs using whiteboards in my office. Now, this was more than 10 years ago. Well, it's probably been like closer to 20 at this point, but we didn't have the same technology we have now. But the point is, coordinated entry staff didn't know there was an opening until I had the time to notify them. Even with today's technology, this is still happening, and you're going to hear that from our panel. When our data is fragmented and not visible, our ability to house and shelter people is delayed. Our goal today is to explore how San Francisco and King County broke down data silos to establish a single source of truth. By integrating HMIS, coordinated entry, and bed and unit management into one cohesive system, they've created a streamlined process that transforms their HMIS into a high-performance tool for their homeless response system. The integration provides a single, real-time roster of inventory, finally eliminating conflicting and outdated data that comes from managing multiple systems. Both communities have moved beyond using HMIS simply for data compliance or data entry and reporting, and they're now using it to operationalize outcomes in their community. Ultimately, we'll see how the system-wide transparency and knowing exactly what's available at any given moment serves as the driver for meaningful change. So whether you're already using a centralized bed and unit management tool, or you're still managing resources across disparate spreadsheets and whiteboards, our conversation today is designed to help you bridge the gap between having a resource and actually filling it. So let's dive in. I want to start by setting the stage about what was happening in King County and San Francisco before. So Cody, I want to start with you. Could you briefly describe your housing and or shelter placement process before you integrated your bed and unit management into HMIS? And can you be sure to touch on what the resource visibility landscape looked like in your community before you moved towards a centralized inventory system?
Yeah. So in your setup there, I feel like you set up all of the problems that we had. And I'm going to talk about mostly our shelter bed inventory, since as you mentioned, that's the project that I managed. Before we had our inventory, our shelter placement process was very manual. And it was spread across multiple systems. So every morning we would gather information about the available beds that were out there using a mix of different sources. Some were like standalone bed management systems, some were just inferred totals, and some were phone calls or emails. And then we have a centralized bed placement team, just placement team within our department. And they would take all that information and manually track availability in a spreadsheet, maybe only slightly better than a whiteboard. And then they would use that spreadsheet to assign out beds to our outreach partners and our external referral partners. And then, as you might expect, those referrals might come back in different systems, including just emails and phone calls. And then, that's then relying on our shelter providers to know how to use multiple different systems as well. And they may be doing duplicate entry. So overall, I would say our process, it worked, but just because people were working so hard to hold it all together, it was not very efficient and it was very, very resource intensive. To that data point, we had very little real time information as to what was going on with our shelter beds. So when they collected the information at that part in the morning, we might have a snapshot right then around 8:30 in the morning of what's available, but the rest of the time you're in the dark. And throughout the whole day of referrals, you're in the dark.
Thanks, Cody. Joel, do you want to speak to King County's prior process as well?
Yes, unlike Cody, I think I'll focus a little more on our permanent housing stock because in King County, our coordinated entry system has all the permanent housing, transitional housing, but our shelter does not go through coordinated entry. I'll talk about that a little in a sec. But the way that we operated coordinated entry, we did do it already in HMIS, but we similarly, like to what Sarah and Cody were talking about, we're relying on agencies reporting their openings to us and kind of posting them in HMIS. And then we would compile that, put it in a report, and send it out to the community so they could do their nomination, nominating their clients to those units. One of the big issues with that is that there's not a consistent level of information that comes with those unit postings because it's essentially just a text box. So there was no, there wasn't good transparency because there wasn't, different providers put different levels of information with their unit postings. And then again, we had no way to verify that providers were posting units at the appropriate times. A couple of years before implementing inventory, we had kind of outlawed external fills in coordinated entry, but we really had no way to monitor that and to know how well that policy was working because we're still completely reliant on providers telling us. And then our shelter system, again, there is no single entry point for shelters in King County as of now. And so it's really kind of different subpopulations kind of have different systems that are not, they don't necessarily go through HMIS. Some shelters just kind of do their own thing and are on their own for filling their spots. So we really had no visibility into how people were getting into shelter, what was the client experience of that, who is our shelter serving specifically. I think really just kind of flying in the dark prior to implementing inventory there.
Thank you both for sharing that. I know it's not easy to talk in a public space about the challenges your community's facing or was facing, but I can guarantee there are people listening today who are nodding along because they're experiencing very similar challenges. And there's probably someone out there who felt like you were describing their community. We know that making system level change can be incredibly difficult and honestly a bit overwhelming because it impacts so many different workflows, so many different teams, your data collection process, the people that are experiencing homelessness. Joel, I was hoping you could start off this next question. So, knowing how high the stakes are to make such a big system level change, can you share what the specific catalysts were that finally drove King County to move past the old way that you were doing things and commit to a change?
Yeah, absolutely. So in 2023, KCRHA, my organization, which was relatively new at the time, we published our 5-year plan on homelessness in King County. And that was a really good opportunity for the community, with provider stakeholders, client stakeholders to really coalesce around the idea that, like, yes, we all agree we need a live inventory with expanded information about that inventory, not just the availability, right? Like the attributes of that inventory. So that 5-year plan included a mandate to establish a live bed and unit inventory in King County. And it really hit on those two aspects, right? Like the attributes. So we need to be able to report on who we're serving, who we can serve, who we're not serving, where is there more demand than there is supply. And then also on that live availability feature, the community really decided like we need to have that capability going forward. And that this is really, again, this is in the 5-year plan, and this is a multi-year process of building up, especially our shelter coordinating. I think even talking to shelters that agree that or that enjoy being able to kind of fill their beds as they wish, even they agree that a coordinated system would be better for clients. So that was one of the main kind of long-term goals. And then in the short term, we're always trying to, like Sarah said in the beginning, build up HMIS as not just a reporting repository, but a place for collaboration, case management. And so it was important, having that live inventory, but also specifically having it inside of HMIS so that we have that as a central place of record that the whole community has access to.
Thanks, Joel. Cody, what was the catalyst for San Francisco? I'm sure there's probably some overlap, but I'd love to hear what was the catalyst to change for you?
Yeah, so I think one of the big ones for us was that we expanded our shelter system by quite a bit over the last few years, and especially coming out of COVID, as I'm sure it was for many others. So, that made the system larger than ever before, which is great in terms of what we can offer. But I think we started encountering like some of those scale issues. So one of those is just you're getting a lot more resources, and people want to make sure that you're accountable for them and using them responsibly. And so in the system we had before, we couldn't answer some pretty basic questions about real-time availability. We could give you some top line numbers, but if you wanted to know something more specific, like what proportion of beds are offline and why are they offline, we didn't have that level of detail. And that's frustrating, not just because you want to put people into beds, but also just for reporting and accountability reasons. And then I'll just also say that the second issue of that expansion was that you have this higher inflow and outflow to your system. So even if you're reducing the percentage of turnover, your N is just increasing by so much that there's just a lot more pressure on the people who are doing placements to beds. And we just could not scale a manual process like we had to accommodate that scale. So we needed something that was a lot more efficient than what we were doing before.
That's great. I think there's common themes here, and they're very similar to themes I've heard from other communities as well. And it's that transparency, the visibility, the level of detail needed for appropriate placement, accountability. I mean, I think these are very common things that other communities run into as well. So, as we've started talking about, system-wide change is incredibly difficult, and knowing where to start can be a big hurdle. I'm certain it's helpful for our attendees to hear what specifically drove your communities to take that first step. And like I said, I'm sure that many are experiencing very similar things and thinking about maybe making a change. But my hope is that hearing about your tipping point inspires someone listening today to realize that this level of transparency is possible for their own community. You are two very large communities, and I think being able to see that you all have been able to make that change is very impressive, but I think it also lets people see that it is scalable and it is possible. So, as we've heard, processes were very manual, very time consuming. Systems like bed and unit management and coordinated entry or a centralized referral process weren't always even managed within the same database. I think in some cases, you might have even multiple databases. I know Cody speaking more to shelter, but I've worked with San Francisco for quite a long time, and they were managing their shelter bedding unit management and their housing bedding unit management in different databases. Plus, they had HMIS. So you're talking about three databases right there. So that can make a placement process very inefficient. It can make it difficult, and it can delay the time it takes for people to come indoors and be permanently housed. Integrating your bedding unit management into HMIS is more than a data collection or a system administration change. It's a community-wide shift that impacts workflows. It does impact data collection. It impacts reporting, and ultimately affecting the work of so many teams. Although the end goal is to improve the human experience, it can be difficult to get buy-in or get the buy-in needed from the community to make such a significant change. So, in addition to my work with San Francisco and King County, I have helped a handful of other communities integrate their bed and unit management directly into HMIS. And without fail, every community asks the same critical question, which is, how do we get provider and stakeholder buy-in? They want to know how to prepare their system for such a significant change. They want to know how they're going to get the providers to agree to do data entry. They also want to know how to turn potential skeptics into champions of the change, because they feel like that will help kind of with that trickle down effect of getting community buy-in from other stakeholders. I know the advice carries more weight when it comes from other people who have navigated and done the work firsthand. So I'm going to ask Joel to speak to how they built community buy-in or community-wide consensus. So Joel, how did you convince your stakeholders that their inventory management actually belonged in HMIS? And if you used any data or created any resources to support this process, if you can speak to those as well.
Sure, yeah. So, right, first of all, the challenge to getting buy-in, I think, is there is this kind of asymmetrical burden on the housing suppliers and shelters providers, because they're the ones that need to manage their inventory. And so that was the most challenging group to get on board, right? Because from an outreach worker's perspective, of course, they want this, they want real-time availability into the available beds. So definitely focusing, with those housing and shelter providers and really making clear from the beginning, from that first 5-year plan all the way through, that this is an infrastructure addition and something that we're going to build together as a community. And so, we're not mandating everything all at once, and we're not kind of turning over their referral process all at once. We're doing this in an iterative way, that we're really kind of going at a pace that is reasonable for those providers to be able to keep up with, just in terms of the technical requirements of managing their inventory. But still, also, we still codified the requirement to maintain that inventory in all of our policies and procedures in our community. So, we have that to fall back on to ensure compliance, but really trying to stay focused on, this is something we're going to build together, and that you're going to get better matches and coordinated entry. So trying to make the argument that this is more efficient for those providers, because they're going to get more informed clients applying for their housing. Also, to your second part of that question about kind of building a data product, we have something in King County called the Regional Services Database, which tries to kind of describe all of the housing and shelter that we have in King County. And so we're in the process now of publishing a new version of that directly connects the live inventory to that regional services database, which is publicly available. And so really showing them that this data is going somewhere, and it can be used for case management, it can be used for broader system analysis, and that is publicly available. And providers have really appreciated that their data and their their eligibility requirements, who they serve, is accessible to the public and to the clients that are potentially trying to find them. Because I think what like the strength of this project is that we do all share a vision of a more coordinated system, especially for shelters, right? Because that doesn't go through coordinated entry right now, and that's been really successful. Just kind of acknowledging that yes, this in the short term is an additional sort of data source that you need to keep up to date, but in the long term, we're putting everything in HMIS, and now we're starting these conversations. I think we'll talk about this later too, but like we're going to get to a point where we actually have fewer places where you need to be entering this data, because as the community kind of coalesces around this one HMIS bed and unit inventory, that'll make operations a little more efficient for especially these providers that have so many funding partners and have to have so many sets of requirements they need to fulfill. Being able to do all that in one tool is really appealing to them.
Yeah, I agree. Another thing that San Francisco did, and Cody, I know you weren't really involved in the project at this point. It was in one of the very early phases. San Francisco piloted with one building and one program first on the housing side, and built out the bed and unit management in HMIS for that one building in that one program as a way to get them using it. It was an opportunity to learn what worked well, what didn't work well. And it was also a way to be able to have that provider talk about how it's working and be able to share their experience with other providers. So I think that's another great way to get buy-in. Cody, as I kind of mentioned, I know you weren't really involved in the very early stages of this. Is there anything else you wanted to add for your community?
I was thinking about that kind of that incentivizing, and I think something that we also did, you know, a project like this is so large that we took that as an opportunity to also revisit some parts of our system that we probably hadn't looked at in a really long time. And we were able to identify some kind of value add for our providers there. So we could say something like, yeah, you're going to have to do this additional inventory piece, but it's only going to be in one system. Like, that's great. And then also we shortened the enrollment screen by half, or like we took out some of these fields that were really similar. We decided we only needed one, so we kind of tried to, I mean, some of that is just messaging to the community, though. We understand it's an effort, and we're trying to, make that better.
Yeah, it was a great opportunity to modernize and
Mhm.
streamline workflows. That's great. So, thinking about the next topic, I worked with both of you when you were collecting data to build out your bed and unit management in HMIS. And it is a heavy lift. You basically have to catalog every building, every unit. What are the bed counts? Because you need to build that out so it can live in your HMIS ecosystem. During that process with both of you, we found things that we didn't expect. What I've kind of been calling hidden resources, which are units and beds that hadn't been reported, or maybe they were resources that were misunderstood, or even providers who were accidentally enforcing extra eligibility criteria that weren't actually required by funders. I know that last one about eligibility criteria, when I worked in coordinated entry, that's something I experienced all the time, that there was this extra eligibility criteria that was being imposed. And a lot of times that's just misunderstanding historical contract information. There's a lot that can play into why that's happening. But I don't think San Francisco and King County are alone in this, because as I've mentioned, I've done this work with other communities and some of these same issues are coming up. So, Cody, can you talk about what I've kind of been calling the cataloging phase, or that data collection phase? And what did you discover during that phase that actually surprised you?
Yeah, so I think you kind of hit on, when you look at every single bed, you're gonna find something in there. I don't remember finding just a straight unknown. We didn't know this bed was there, but we uncovered a lot of things that were that kind of what you mentioned, that next level of detail that maybe we weren't getting before. Like an example of we're still kind of integrating is like we knew we would want to know what beds are wheelchair accessible, for example. But then as we're doing that, we kind of realized you'd want to know what beds are not necessarily wheelchair accessible, but maybe you don't need to use stairs to get to that bed. So you could have a client that's limited with stairs, but maybe that doesn't need all the space requirements needed for wheelchair accessibility. And prior to unit level information, you might just know that a shelter has one wheelchair accessible bed, and if it's taken, it's taken. But when you can get to that next level of detail, maybe you can know that there's a bed that you don't need stairs to get to that, and could that work for this particular client? And so there were a lot of things like that could mean clients are getting more appropriate placements, and could theoretically mean that you're utilizing a higher percentage of your inventory. There were also things like just the kind of standardization that it allows you to do. So we had some sites that were converted tourist hotels, and since they're not purpose built for shelters, they would have some room offlines for operational reasons, like offices or guest meeting rooms and stuff like that. And when you don't have a unit level detail, you just don't have any way to standardize that across sites. But as we were collecting that and we're asking them, okay, so what do you use this room for? Why is it offline? That lets you really say, like, well, here's what we would expect. Say for 100 guests or 100 rooms, we would expect you to have, say, 2-3 rooms offline. And when somebody's really above or below that, you can standardize. And I know we kind of brought some rooms online for occupancy after going through that.
I think one other thing that came up too was talking about like bed counts, for example. I think you had said, there weren't any beds where they just weren't reported at all, and you learned that they existed. But I do think one of the things we also learned were, maybe a building had 50 beds in it, or 50 units in it, but one was being used for an office, or one was being used for another like agency specific resource, that it was a great way for us to be able to demonstrate that within HMIS too, like why there's always one or two units that aren't being utilized. And it's not lack of utilization, it's because of other circumstances like staff offices.
Yeah, exactly. Yeah. And you would get, if you're a member of the public and you see we contract for 50 rooms, you would be confused why we only have 48 rooms available for occupancy. And yeah, exactly to that. You might need one offline all the time because something could go wrong, and you don't want somebody out on the street because there was a leak in a room or something like that. It let us really speak to exactly what percentage of the system is doing things like that.
Yeah. So I want to pivot and start thinking about the strategic shift. So we often talk about HMIS in the context of data collection or data compliance and reporting. But when you pair HMIS with live inventory data and coordinated entry, or some people call it a centralized referral process, you start turning your HMIS into a tool for action. Joel, how has this integration helped you address the issues you were facing before integrating bed and unit management into HMIS?
Yeah, it's been such a huge help for our coordinated entry system. I mean, we just have so much more information about a given opening and coordinated entry than we did before, and it's so much easier for the prospective clients and their case managers to access that information, and it gets distributed in a somewhat automated way. So it's less labor intensive, and it's a lot more information. And so we've gotten just a lot of great feedback from like our housing navigators about just how much easier it is for them to sit down with their clients and go through the list of available openings and really discuss, okay, this client has a dog. We need to filter for PSH buildings that allow for pets. Or, just the rent payment calculation. There's so many ways that different programs calculate rent payments, and, what is going to work for this client? What is the best situation for them? And then the flip side of that, the housing providers that are then receiving those referrals are getting clients that are more prepared for the requirements of living in that building, understand the eligibility criteria kind of at that point of referral rather than learning it all kind of at post referral. So just more successful referrals, and it's just been more efficient. Better information has been great. On top of that, because we have all these beds in the system, we have dashboards internally where we can monitor, compliance / performance of those units. So how long does it take to fill these units? That's information that we didn't have before. And it has really, helped us understand which questions we should be asking our providers. So, right, we can identify, here's a unit that is labeled as going through coordinated entry, but we have an enrollment into this unit that is not attached to a referral. And we can follow up on that. We can ask the provider, hey, what happened here? Maybe it's allowable, maybe it's not, but we get that question answered, and we can just go to one place, and that's, we know that we can go there, and it'll give us all of the kind of the starting point to where we should be focusing our attention. So it's so helpful in being able to take this huge system that we have and really distill the questions that we need to be asking our providers and following up with. So monitoring wise, it's just been incredibly valuable and meaningful to our coordinated entry team, who is, I'm sure everyone on this call is not inundated with new funding opportunities. So the ability to just do that more efficiently has been really important. On top of that, I'll just kind of speak to reporting also has gotten more detailed. Shelters, we get so many data requests on shelter utilization. The community is really honest about, are we utilizing our shelter beds to their fullest extent? And where before we would say X shelter has a 90% utilization rate, we can now say that, and we can say, okay, what does that 10% of unutilized beds look like? Because, right, when a unit is offline, you have to give an offline reason. And so we can say, yes, the shelters, it says 90% utilization, but, they have to turn these beds over, they have to clean, they have to do maintenance. And we're able to fill in those gaps a little better to really contextualize what those shelters are going through on the ground and why their utilization might not be the 110% that the public sometimes expects. So just that, both having all the information there and then being able to report on when it is and isn't being utilized and why has been really helpful.
Joel, prior to having your bed and unit management and HMIS, when you would have to pull data or be able to talk publicly about shelter utilization or just answer questions coming from public spaces, did you have to pull data from multiple sources and compile it together to be able to answer questions?
It was more often, here's what the data, here's the utilization according to HMIS and according to our contractual obligations. But then you'd have to supplement that with, shelters, I've said it so many times, shelters are telling us they're completely full and they have no extra capacity. And that sort of devalues the utilization rate that you're reporting, because you kind of have to walk it back immediately with, like, this is not necessarily the experience on the ground that we are being told is happening. So having this extra data to support the utilization rate has been really helpful in contextualizing for funders, just what a utilization rate really means, how it's calculated, and being able to explain why something may not always be 100%.
So now the data can speak for itself without having to have an asterisk next to it, or
Exactly. Yeah, getting rid of the asterisk
with it.
has been great.
Yeah. Cody, let me pass it over to you. What about San Francisco? How has the integration helped you address the issues your community was facing?
I mean, definitely that the data, the asterisks and caveating data. I mean, that we would do that all the time, and I don't think it was satisfying for us, and I don't think it really builds trust in your data. And so being able to say, this is what it is, and here's what every bed is, I think that really helps to build trust. But so kind of from our before and after, if you recall our setup before of all these, manual gathering things across multiple platforms, that's gone. So we don't have to go across multiple platforms for information. It's all in one place. And there's not a person who has to piece it all together every morning, because it's in the system. It's already pieced together. Our guest placement team can see what's available in real time, and they can filter for different shelter types or different bed types if they're interested in something specific. And something that this kind of unit level information has unlocked for us is additional functions that you wouldn't have been able to do before. So for us, that internal guest placement team that assigns out beds to outreach partners, they can look for available beds, and then they can allocate them out to outreach teams, all within one kind of centralized platform. And then those outreach teams can just sign in and they can see what allocation they got. They don't need to wait for a meeting. They don't need to go attend a meeting. They don't need to wait for an email. And so it's taking out manual work, not just for us, but also these other outreach teams and other departments that we might, before they had to attend these meetings and kind of wait for us to give them their allocations. So that's been a really big improvement for us and has, really reduced the staff time of just manual entry and trying to, collate everything into one place.
Yeah, I think too, listening to both of you talk, I think one of the things about having this integration with your bed and unit information, it's not just about having the beds and units in there, that there's this level of detail about unit attributes and bed attributes that is giving you this more detailed view of information to make appropriate placements. There's obviously a big reporting impact here. And, I've been talking with Cody a lot lately because we're working on a project together and we're constantly working on other things together. But one of the things Cody said to me recently was that there were simple reporting questions I couldn't answer before, or they felt like they were being viewed as uncooperative in their community because they really couldn't answer the questions. It's not that they didn't want to, they couldn't. And now they're able to do that and partner better with stakeholders and local government and other people to provide the data that's needed. And so I think, this goes beyond just having the information in HMIS, and it's really impacting communities in different ways that go above and beyond that. So one of the most powerful aspects of integrating bed and unit management directly into the HMIS platform is the ability to leverage automation and streamline workflows, which we've started to touch on a little bit. And at Bitfocus, one of our goals is to reduce the administrative burden on frontline staff as much as possible. And by syncing HMIS and inventory data, a bed can automatically mark as occupied the moment a referral is completed. It can flip back to available as soon as a client is exited from a program. And if you think back to the example I provided earlier, when I was managing housing programs and I said it could take me days to post an opening because I was busy or working with clients, and there's a lot going on in everybody's day-to-day work. But when HMIS and bed and unit management are working together with automations, the coordinated entry team can see a unit is available immediately. It can reduce the time from somebody moving out to a new referral from days to hours, and you don't have to wait for somebody to go in and post that opening or send an email. However, this automation only works if the underlying data is current and stays up to date, which I know can be a challenge that extends beyond bed and unit management and coordinated entry. I think this is something that happens in everybody's day-to-day work. But for the system to truly serve as a real-time roster for the community, it does rely on providers to maintain timely data entry. And as I mentioned, I know this can be a challenge. So Cody, I was hoping you could speak to how do you ensure that the data stays real time? What strategies are in place to encourage providers to do timely data entry?
Yeah, and Joel kind of touched on part of this, like the real-time reporting is really helpful. So the transparency piece. So, if we're looking at the data and suddenly a large group of beds goes offline, was that because there was like a water leak or did somebody make a mistake? And since all the reporting is real time, we can spot those pretty quickly and reach out. And so like there's this communication chain. People know the data is real time and is real. And another part for us is that the data is actionable since we're using it for real-time referrals. So if you are a shelter and your bed says that your bed says that it's available, you might get a referral to it like within hours or minutes. So that's a really huge incentive for a shelter to keep their inventory updated. If it says it's available and it's not, you're going to have to scramble when somebody shows up and they're assigned to that bed. I will say there's places we find things that are outdated, but most often that's stuff that we're not looking at very often. So like a room feature we maybe thought we wanted, but we don't really use that much. So I know we'll talk more about advice, so I'll try not to get too ahead of myself, but I would say like don't put things in your inventory unless they're going to be actionable information for you. Because if nobody is looking at that frequently, it's going to get stale or it's going to change. And then later, it's just going to confuse you as to why it says what it says.
Yeah, that's a great point. I think I've seen a variety of levels of information that people put in the system, from collecting, 5 things like key unit attributes, like is it an ADA unit? Does it have a shared bathroom? Some key critical information, to people collecting 50 different attributes about units. And you're right, like if nobody's maintaining it, it's going to become stale on its own. Joel, I know you weren't as involved in the process when, with talking to providers and encouraging timely data entry, but I just wanted to give you the opportunity to chime in if there's anything you wanted to add.
Yeah, I mean, I think our main takeaway, like Cody said, is making the data actionable and saying, you know, this data is going out, whether it's to our regional services database or it's being used to inform coordinated entry referrals. That is the single biggest incentive, because in order for these providers to be able to run their programs efficiently in the way they want to and effectively, then they need to keep that data up to date. So it's really nice sort of having those like natural consequences to not being real time with your inventory. And that's, I think, the single most effective way to ensure it. We've also tried to be generous where, like Cody said, right, where there isn't something actionable, relax requirements a little bit. So to say, like, okay, if your units are not kind of being operationally used to refer to in real time, then we have a slightly relaxed timeliness requirement for those units. So it doesn't have to be same day. So just trying to like be good partners with these providers and saying, acknowledging that it takes work and labor to keep that data up to date. And if we're not going to use it like that, then not expecting them to, keep it up to date accordingly. And then just always having kind of the understanding that when it does become operationally necessary, then that much shorter timeliness requirement does go into place.
And I can imagine that this wasn't perfect in the beginning and that there were some bumps when y'all made the shift and there was this reliance on real time or timely data entry. Would you both say that's accurate, that it was a little bumpy in the beginning? And as providers realized my referral is dependent on me exiting this client, or, I've got to say we're done cleaning the unit in order to get a new referral, that the data improved over time?
I think we would see that too with if you weren't used to keeping stuff up to date, you might say like, oh, this says it's available, but it's not that specific one that's available. It's this other one. I just haven't had time to kind of move the beds around to say this is the one that's offline and this is the one that's available. And that's kind of fine if you don't have unit level inventory. You have one bed and you can tell people I have one bed and you deal with it later. But when you have that unit level, now it's got to be right, because they're going to get referred to that bed and it's just going to cause you a bigger headache when then you have to move them around later. And so I think we're getting better kind of knock-on effects about real-time information about things that are not just that available bed, but maybe the other offline bed or the bed that's being, repaired. There's incentive to keep all of it, correct?
Yeah.
I think I would add to that, like for our coordinated entry team, they've really been able to hone in the more time we've had with this on like what is the best way to follow up with providers, what is the best kind of data red flag that you should be going off of to kind of raise something. Maybe this requires, we have to set up a meeting with them and make sure that they're, all up to date on the training and they know which buttons they're supposed to be pressing. So it was definitely a learning process, I think, on both the provider side and then on our side, just effectively managing that new workflow and figuring out how best to support our providers with it.
Yeah. And I mean, with any change, you have to be willing to pivot and make changes or offer support for your providers with anything that's new. It's going to take some time. So at the end of the day, this work is about the person standing in front of us who needs a place to sleep. And it's critical that any change we make to the homeless response system is designed to improve the human experience. So I want to look at the big picture impact here. When we try something new, there's often a natural fear that it won't work or have the intended effect. But we don't want to lead with that fear either. Instead, we want to have the courage to try something new, keep our focus entirely on the end goal, which is improving the system experience for everyone involved. When we lean into real-time visibility, that's when we start to see those significant system level shifts. So Joel, I was hoping you could, now that you guys have embraced this integrated model, what's the most significant system level improvement that you've seen?
I think the most sort of tangible improvement has been that client choice and system transparency when choosing which coordinated entry unit you want to not be nominated for. I just think that putting that power in the client's hands to make an informed decision has been really powerful. And then also putting the power, empowering providers to maintain their own data and, in some ways define their own eligibility criteria where appropriate, has been really powerful. But I also want to just mention, because, to your point, Sarah, the point of this whole project is to make our system better at getting people into shelter and into housing. And, we work really closely with the city of Seattle in King County here, and they really want to see a tool that works. They want, a proof of concept before they change their own workflows, right? So like they refer into beds, they use a system outside of HMIS. Us having this proof of concept, using it in coordinated entry has really helped accelerate conversations around shelter coordination and how do we as a community have a more centralized pathway to shelter. We just had our point in time count, and I heard from so many people about just how dizzying it is from someone experiencing homelessness trying to get into shelter without there being this coordinated effort. And so having this proof of concept and this tool to really gather people at the table and say, okay, here's what we're working with. It has so many functions. We can do a lot of things with this. And we're having really productive conversations now about how we can use that to build going forward and, get everyone on board using this single tool, getting rid of a lot of that data entry duplication. So that's kind of what I'm currently most excited about is the conversations that are happening right now around building a system for shelter and really showing our other funding partners that this is a tool that works. And, we can build it. Providers will use it when that data is actionable, and going from there.
If you build it, they will come.
Exactly.
Something you just were talking about, how proof of concept, we've sort of inferred or talked about this in passing, but we haven't explicitly said it. And it was actually true for San Francisco as well. Doing a phased approach. I don't think we've specifically said here, we didn't make this shift overnight for the entire portfolio for San Francisco or King County. We did it in San Francisco in many phases, and then in King County, you focus more on coordinated entry first. And so I think that's just an important point for communities just to know or think about, is that you can pilot or you can do this with one project type to start, to get that proof of concept, to learn what works, where are the bumps or the areas of improvement, so that way you can take that forward as you roll it out system wide. And I know we hadn't really planned to dive into that much today, but now that we've just thrown that out there, Cody or Joel, do either of you want to comment on the phased approach? Because, initially, I will say I was apprehensive about it because I was thinking, like, let's just build it all out and do all the work at once. But now that we've done this multiple times with multiple communities, I think the phased approach really has a lot of benefits and is the way to go. And so I just wanted to open that up and see if either of you had anything to say about rolling it out in phases and the benefits of that.
I can start us off here. I think it's been really essential for the success of this project that providers feel like we're moving at a pace where they can bring up an issue, we have the capacity to address that issue, and that we're monitoring what they're doing, we're listening to their feedback, and we're kind of working out those kinks. I think where you can really run into trouble in implementing such a large project like this is you implement it and then you don't have the support to those providers, because it takes a lot of meeting with them one-on-one and talking through how they specifically run their program and how that kind of gets translated into live inventory. So it's been great that we've gone at a pace that providers can give their feedback and we can respond to it, and that we are not kind of stretching beyond our own capacity, trying to do everything at once, that we can say, okay, let's make sure coordinated entry is working and that it's functional. And then when that's in a good place, kind of switch over to shelters, which is what we're doing now. And kind of, in some ways repeat that same process with shelter providers. And now we're hearing their feedback and what is working for them, what is not working for them. So it's been really effective for us.
Yeah, I think that's a really good point, the flexibility, because early on in the project, you're kind of just starting with this stuff and you might not know you have a guess as to what's going to work best, but they might tell you like, oh, that doesn't work for us. And if you had already announced it to 30 people, that's just a lot more work now you have to claw back. So piloting and then kind of expanding your pilot, and then I think we had 2 phases, and we you can divide these things in different ways. So like I think on the housing side, they did it by funding source, since those were kind of similar referral pathways. And on the shelter side, we had kind of different types of emergency shelter. We had like nav centers, we had congregates, we had some of our larger ones that we broke out. So you can tackle it a lot of different ways.
Yeah, I agree. And I think one thing to also point out here is timeline, which we haven't really talked about at all. And the timeline for this, part of it is based on the size of your community, but for both of these communities, we were at least like a year to build this out. And so Joel kind of talked about like the pace in which you do that. And I think just being realistic for anyone listening today, this isn't something that you're probably going to do in 3 months. It's something that's going to take 6 months to a year to really do at a system level, to be very thoughtful about it. And it's going to take some time. So, we've spent a lot of time today talking about how to and immediate system impacts of integrating inventory. But one of the most powerful realities of this shift is being able to take those operational successes and turn them into a clear data story for the community, for government officials and funders. It's about moving from a reactive space to a proactive one where you have a clear, transparent view of your resource gaps. As we look at the progress both San Francisco and King County have made, I'd love to leave our audience with some practical takeaways for their journey. So, Cody, I'll start with you. Knowing what you know now, what's one piece of advice for a community that's still using a more siloed process and they're, starting to think about a change of maybe integrating bedding unit management into HMIS? What would be some advice for those communities?
So one of the things we kind of already touched on a little bit, but that I was thinking about was there's some of the obvious costs of the silo approach, like staff time, or just kind of like how much longer it takes to do a really onerous process. But the thing that we had touched on was that kind of trust in the system. And Joel mentioned this as well. When you're saying data and then you're caveating it, or you're making these conditional statements like, oh, well, here it's this, or here it's this, and we are inferring this based on something else. Um, particularly for the executives or the electeds who just really don't care about that kind of nuance, it could make you seem like you're hiding the ball, or like you're not trying to cooperate about everything. And so now we can put that data in front of it. We can post what we can online. You can put it in regional databases. And when somebody asks, well, like, why is 10% of the system like never occupied, I can tell you exactly why for each little proportion within there. Like, well, there was a water leak at one of our big sites. And I think that it builds the trust that before we weren't getting. And I'm hoping that starts to pay more dividends of just kind of trust in the system. But I guess as far as like advice, I touched on this too, but using this as an opportunity to look at some places in your system that maybe you haven't looked at in a long time. There's a lot of parts that are tangential to a project like this. Yeah, it's just inventory, but to get to inventory, you got to enroll people, and to free up the inventory, you got to exit them. So you might as well kind of look at those pieces of your system too. And you're going to have to think through your workflows. So, what could this open up with updating workflows as well? So like we use that as an opportunity to modernize a little bit, eliminate old fields or redundant fields. And I would build that into your timeline, because it's not gonna, as you mentioned, like this is gonna take at least a year. I mean, depending on the size of your community. For us, it took longer. But it's not gonna take that much more time to add in those pieces. And you'll come out of it feeling like you kind of have a refreshed lease on the system that maybe before there was a lot of stuff hiding that you weren't aware of.
Yeah, there's an interesting question that came in the chat. And Cody, I know this is kind of putting you on the spot, but I feel like you'll be prepared to answer this. And I wanted to answer it now before Joel gives his advice, because you were talking about streamlining and modernizing workflows. So the question is, how about the pros and cons using a call center attached to this, especially for first responders and non-provider referral sources? And I know you probably can't speak to first responders, but I was just thinking about 311 and the call center and how you guys use this as an opportunity to update the workflow that involves them, and
Yeah.
maybe just speaking to that a little bit.
Yeah. So yeah, we do, we have a citywide call center and we do kind of maintain a shelter wait list. I think what this has allowed us to do is work a little more flexibly with our beds sometimes, so we can kind of set aside an allocation of beds for a specific partner and work with them for the referral process to those beds that could work specifically for them. And we have a few different projects like that. So we do have like our call center that can make referrals into beds. We have our general assistants that can make referrals into beds. We actually do have a first responder pilot program that we're running right now. And this stuff can kind of, once you have this unit level inventory and you have kind of a capacity in your system, I feel like it's allowed us to set aside these dedications for particular reasons. And then, you can work on what the referral process is to those, but this at least is giving you that, like, well, I know we consistently have, say, 10 beds at this site every night, so that's a great place to put a pilot program. Or I know how many referrals I'm gonna get from this call center, so let me dedicate, some amount of that, and then we can pull back some of those flexibly if we have over capacity or over referrals from other areas.
Great. Thanks for letting me put you on the spot, but I knew you could answer it. So Joel, I'll pass it off to you if there's any advice you'd like to leave the communities listening today.
Yeah, I think the most maybe practical piece of advice I could give is just meeting with those providers early and often to make sure that you have like the shared vision of what you're building towards, because the payoffs are not immediate, and so it's really important to just stay anchored to like, what are we building towards and why are we doing this? And because there are just so many, like, as you sort of dive into the practicals of like transitioning your systems over to this live inventory, there's just like this infinite number of choices you can make about workflows, about, how do we handle scattered site, rapid rehousing programs, like bringing inventory into like attaching it to these physical units means a lot of different things for a lot of different programs. And I think for the system to really function well, you need to meet with your providers and say, okay, how does your program work? And is this going to work for you? Where are areas that we can be a little more flexible and, maybe abstract the live inventory enough so that you're able to complete your work, and we're getting what we need from the data. We're staying like, back to that shared goal. Like, does this give us what we need to build a shelter coordination system that provides live bed availability? If that does it, then okay, maybe you don't need to be quite as exact about your bed assignment or something like that. So just like really working to understand the ins and outs of especially those large and complex providers, and how they enter data into HMIS, from the front desk worker all the way to their data manager, was really important for us, and just making sure that each and every agency is, providing their real-time data accurately.
That's great. I think your community was particularly interesting to work with because you do have some really large housing or shelter providers that use external systems for case management. And that was a really interesting component of thinking about how to make this work. And like you're saying, needing the data to be real time and partnering with them, but also they have this external system they're using and how to navigate that. So that was, like you're saying, communicating early and often. We learned about that very early on in the process, which became like a critical thing to consider throughout the work. So that was definitely a unique thing that came up with your community. And had you guys not been communicating, we may not have learned about that very early on. And it may have been after everything was built out and ready to go. And then we would have had to undo some of the things we had already done. So that was a great thing to learn about early. So as we wrap up today, if you're not a current Clarity user or Bitfocus customer and want to learn more about our bed and unit management tool called Clarity Inventory, Sean or Scott is going to drop a link in the chat so you can learn a little bit more. For those using Clarity, who are thinking about using Clarity inventory in your community, we're also going to drop a link to our inventory toolkit, which is a great resource to help you start planning and thinking about the work that it would take to build out this bed and unit management in your HMIS. I want to give a huge thank you to Cody and Joel for sharing your time and expertise with us today. I know you're both very busy and you have a lot going on, and so I appreciate you taking the time to spend with me today. And then also a thank you to all of our attendees, really for the same reasons. I know you're busy and you took time out of your day to come and listen in. So I appreciate your time. I hope everyone has a wonderful afternoon, and we hope to see you at the next Clarity Cast.